Good morning. Myself NIYATI DHADUK. Today's topic is cervical spine injury, phase 1 and orthopedic management overview. Cervical spine injury can range from minor sprains to severe fractures and dislocation. Promote an appropriate management is crucial to prevent further injury and optimize patient outcomes. This overview will guide you through the key phases of orthopedic care for cervical spine injury. Immediate post injury to management, spinal immobilization, airway management, vital signs monitoring. Spinal immobilization, stabilize the cervical spine using rigid collar, backboard, or other appropriate equipment to prevent further movement and injury. Airway management, ensure the patient's airway is patent and protected, providing supplemental oxygen as needed. Vital signs monitoring, closely monitor the patient's vital signs and neurological status, making promote intervention as required. Immobilization and spinal precautions, cervical collar, backboard stretchers, log rolling technique. In cervical collar, rigid cervical collar help restrict neck movement and protect the injured spine during transport and initial evaluation. Backboard or stretcher, patients should be moved and transported with the spine full immobilized on a rigid backboard stretcher. Log rolling technique, when repositioning the patient, use the log rolling method to maintain spinal ligament and avoid further injury. Clinical assessment and diagnosis imaging, history and physical examination, radiograph evaluation, neurological evaluation. In history and physical examination, obtain a dilated history of the injury mechanism and perform through physical examination, including neurological assessment. Radiographic evaluation, order appropriate imaging studies such as X-ray, CT scan, MRI to identify the type and extent of cervical spine injury. Neurological evaluation, assess for the neurological defects such as sensory or motor impairment to guide subsequent management. Determining the severity of injury, stable and unstable, fracture pattern, spinal cord involvement. In stable and unstable, injuries are classified as stable when the spinal column is intact. When unstable, there is a risk of further displacement or neurological compromise. Fracture patterns, like cervical spine fracture, can include compression, burst, flexion, extension, and rotational injury, each with unique management consideration. Spinal cord involvement, the presence and extent of spinal cord injury is determined by neurological assessment as crucial in determining the severity and treatment approach. Non-operative treatment, like cervical immobilization, pain management, bracing and traction. In cervical immobilization, patient will be stable injury, may be managed with a rigid cervical collar or hollow vest to restrict neck movement and allow for healing. Pain management, like analgesis, anti-inflammatory medication, and physical therapy, can help manage pain and facilitate rehabilitation. Bracing and traction, especially braces or traction device, may be used to maintain spinal ligament and promote healing in some cases. rehabilitation and physical therapy, range of motion, strengthening, balance and proprioception. Range of motion, how? Gradual restoration of cervical, spinal mobility through specialized exercise and manual therapies. Strengthening, that is one type of exercise, targeted exercise to rebuild muscle strength and stability around the cervical spine. Balance and proprioception, this is one type of exercise to improve balance, coordination and proprioception for safe return to activity. Monitoring and follow-up care, right? Radiographic evaluation, neurological assessment and physical therapy progression. Consideration for return to activity, like functional evaluation, gradually progression and protective equipment. In function evaluation, comprehensive assessment of strength, range of motion, balance and functional abilities. Gradual progression, this is one type of stage, gradual return to activity, starting with light exercise and progressive increase intensity and duration. Protective equipment, use of specialized braces, collars or other protective gear may required to ensure safe return to activity. Thank you.